All right, well, hello everyone. This is a review for the practice activity. So in the portal, there is this practice activity, which is 7 pages long, reviewing some of the concepts related to chapter 3 in the Levangie textbook about the different phases and types of muscle contractions, going from a concentric, eccentric, and isometric contractions. And this factors a lot into how we design and craft our exercise programs from the early phases to the additional phases, and to understand how we might phrase this. Even from going from standing to sitting, a lot of times you see patients or even athletes, they just sit down really aggressively. They kind of plop down in their seats, and that is a fast eccentric movement, which creates extra compression and extra force in the muscles. So we look out for that, and we try and have them slowly lower themselves. So that's one example of this. But you went through parts A and B, so what I just wanted to show you is looking at part C, and I thought I'd just do this in real time so that you can see how, if I were to take this quiz, or if this is in an exam, how I would approach this. So we have this practice quiz, and you have a patient here. So you have Jackie. Jackie has normal flexibility, range of motion, and manual muscle test grades are strong, 5 out of 5, without any pain. Although it's difficult to see, she has a 5-pound dumbbell in her hand, or a weighted ball, just to add to that. And so this is pictured, she's standing upright in anatomical position, and she's going from A to B in this exercise activity. I do note here that it is at a controlled speed. It does change slightly if this was at a rapid or aggressively performed speed, but just to say it's a normal speed performing the motion. So going from an elbow extended position to an elbow flex position. And we'll just say this is full elbow flexion, which in terms of end feel, remember that's going to be a soft or a soft tissue end feel because of the soft tissue approximation. And so we're looking at agonist, you may be thinking prime mover, and we have this XXX. So how would we approach this? Well, the motion, you don't have to put this in here, but I'll just spell it out. This is performing elbow flexion, so she starts in an extended position, she's going into a flex position. So with that, as she does that, what are the concentric movements? When you think concentric, you're probably going to think shortening. And when you think eccentric, you're probably going to think lengthening. Once again, you don't have to type any of this in there. Just put this in gray, just to say that those are the things that I'm thinking about as I read through this. So what are the muscles that are shortening as she performs that? Well, we're definitely thinking of biceps brachii. You're probably also thinking of brachioradialis. You may also be thinking of brachialis. Those are the primary ones. Now you may be thinking about the other muscles that cross the elbow joint on the anterior side. So you might be thinking about flexor digitorum superficialis, which crosses the elbow and attaches distal to the wrist. So that's going to be a weak elbow flexor. It's going to be more of a secondary mover. So that would be a possibility. You're thinking flexor carpi ulnaris, flexor carpi radialis. Some people say palmaris. I mean, say probably not too much of a contributor to that. But there are some other options there. Once again, you just really need two, with two main ones there. Now for eccentric, as she does this motion going from A to B, there's going to be some muscles that are lengthening. And so you think, okay, what is lengthening as some forms of flexion? We're probably thinking triceps, which is a possibility. However, I'm going to say to ignore triceps for now. And for this one, I want to put this in here. Because even though the triceps is lengthening, if you were to test this via EMG, you find that the triceps is contracting very little, because if the triceps were to contract, it would be fighting, again, antagonist for the biceps. So even though it is an antagonist for elbow flexion, it's it's not really contributing to that motion. The body is going to naturally have to tell the biceps, brachioradialis, to contract, to fire the motor neurons, to cause the actin and the myosin to move, and it's going to tell the triceps, hey, take it easy. We don't need you right now. If we're doing elbow extension, we'll give you a call and let you know. But right now, the biceps, brachioradialis, it's got this. They have this. So for that reason, that's what we're going to do there. Now let's look at moving from B to A. So going from an extended position, a flex position, to an extended position, we're doing elbow extension. But if you go from B to A, she's standing upright on planet Earth, so we're going to know that gravity is going to force downward, so gravity is going to perform elbow extension. So we don't need the triceps to kick in for this. Even though the triceps is shortening, we're going to say, hey, triceps, we don't need you. Antonius, take a break. We really don't need you. And what's going to control that is going to be the biceps brachii. And then any of these guys over here, they're also going to control that motion. So they're slowly allowing the muscle to lengthen at a controlled speed. We know that she's not just going to let the weight go really fast from B to A. She's going to do that in a controlled manner. Gravity is going to want to take that weight down 9.8 meters per second squared. So it's going to be fast, but we're going to try and slow down the speed or the velocity at which that forearm and that hand and that weight move. And the biceps brachii are going to be responsible for doing that. So that's the first page. Let's look at the second page here. So different scenario. Now you have Mandy, a 15-year-old female basketball player. She's got weakness with shoulder extension. And then everything else is unremarkable. She's got full range of motion, no pain, does not have any signs of acute inflammation. Just try to make it as simple as possible here. Question: what four muscles are most likely contributing to this weakness? And there must be a reason for why she has limitations with shoulder extension. We don't have to worry about why at this point, if it's a nerve compression or there's some pain causing another response. We just want to know which muscles might we want to further explore with our muscle testing, with our palpation, with our other tests, so that we can determine which muscle is the primary culprit to this issue. So for shoulder extension, we're probably thinking of the latissimus dorsi, so we have the lats. We're also probably thinking posterior deltoid. We're probably thinking, I mentioned the lats up here, and the lats are going to obviously extend the shoulder, adduct the arm, internally rotate, and we think of lats little helper. Teres major, okay, lats little helper, as we learned about it when we went to school. Those are the primary extensors. Now, to a degree, there is the triceps. That is also a shoulder extensor, and these are going to be the primary shoulder extensors. I did notice the kinesiology textbook lists the pectoralis as a shoulder extensor, but we generally think of it as a shoulder flexor. But in certain positions, depending on how the humerus is positioned relative to the trunk, there are some ways it could extend. But these are going to be your four primary muscles. And the primary mover, probably the strongest shoulder extender, is going to be your lats. It's a very large muscle. It's a well-positioned, especially the further into flexion you go, the angle becomes improved and the lats become lengthened, so there is some passive tension there. But going to the next question, of the above muscles, which two muscles are the primary contributors to the motion of shoulder extension? So which two, if you have to pick two of these four, which ones did you say? Well, definitely the lats, so we'll copy that. And then I'm going to also say posterior deltoid. That's going to be a strong contributor to shoulder extension. And then, because I can do this, I'm also going to put a third one in there. I'm going to say teres major is also going to be a contributor to that. But if I pick two, I'd probably go with lats and posterior deltoid. I would not go, key for this is I would not choose triceps. So triceps, okay, so triceps, I would say no. So that would definitely be one of those wrong ones. It's a contributor, but it's not going to be a primary contributor. The triceps brachii, especially the long head, is a primary contributor to elbow extension. It may even be a secondary contributor to lower abduction, but it's kind of focused on elbow, not the shoulder. So next question, question number 5. Please rank the contraction from most. So most is going to be a 1, least is going to be a 3, and this is potential force because there are other factors, but let's just look at potential force during a typical contraction. Well, we know that eccentrics are going to be your most aggressive, so in terms of most force, we'll put eccentric as most. Isometrics are going to be in the middle there, and then concentrics are going to be the least amount of potential force. And this factors into, let's see, this factors into the force velocity curve. So I'll copy this to get it ready. There it is. Okay, so there it is from the, this is the Newman version, which I like, so you can see here in terms of force on the y-axis, you see eccentrics, especially eccentrics at a high velocity, but even eccentrics at a low velocity is still going to be more force than isometrics, and the isometrics are going to be more force than a concentric action, although if you're doing eccentrics at a really slow velocity or you're doing concentrics at a really slow velocity, they basically merge into isometrics, because if the velocity is approaching 0, essentially that's where isometrics would be. But let's just say the majority of eccentrics are going to be somewhere in this range, and the majority of concentrics are going to be somewhere in that range. And so now for number 6, excuse me, this is more of an application question. So now you have to take questions 4 and 5. So we know we're looking at, let's say we're looking at the lats and the posterior delt, and now we're also adding speed into that. And so now we have to list the specific motion and specific phase. We want to do the least amount of force. We want to gradually work our patient into this. So what would be the least forceful we're going to look at? Well, we know we have to do some type of shoulder extension. That's coming pretty great down. Just kind of like this. Blue here. So we have to do some type of shoulder extension, and we can do that with a resisted band, sometimes we call it T-band, TheraBand, and I actually got a picture of this ready. Just scroll from my clipboard. Okay, so here we go. Copy this up here so this fits on the same page. Okay, so that way you can kind of see both here. So you got the force velocity and you got that. So if this patient, it's not labeled here, but let's just say, here's some text wrapping here. So shoulder extension, you can see as she starts in this phase on the left, so we'll say in a flexed position, moving towards and extended position. So what effect would this have on the latissimus dorsi or the posterior delts? They're going to be shortening. So as she goes from left to right, you can see in the left position that the posterior delt's in a lengthened position. It's not fully lengthened, but it's in a lengthened position, and now it's in a shortened position. The posterior delt's contracting, it's bringing the humerus towards the axial skeleton. So this is the concentric, or sometimes called positive, or you could call it the shortening so it makes sense to start with this phase. And now you may be wondering, well, how do we focus on this phase but not the extension mix? She's going to bring that band down, and then she's going to release it up. So she's going to do a concentric, eccentric, and then she's going to repeat that. One thing you see people do sometimes is to focus on the concentric phase, is they would do a concentric action. So she would start here, extend it, so she'd do a concentric, and then she could walk towards it, or use her other hand to bring her arm up to basically skip that eccentric phase, and then she could bring it down. And there's some different ways to do that. We sometimes call that one down, two up, because it's contracting with one and then eccentrically releasing with two to make it easier. Either way, this would be the motion, would be shoulder extension. There's many other options, but there is going to be some type of shortening contraction. I would add some type of resistance to that to generate the least amount of force. Now let's say a few weeks go by for Mandy and we want to make this a little more challenging. Now our goals have changed. Now we want to produce the highest amount of force. How should we focus on that? Well, to produce the highest amount of force, we want to basically be in that top left corner here. So we want to be in the eccentric phase. So we want to do fast. And we want to do that. Okay, so if your goal is to produce highest, we want to do that. And so you can think of some different ways in which you might apply that exercise. Two other just questions to finish this up. Let's say you had a heavy leg workout one day, and you have DOMs the next day, or DOMs can sometimes peak at 48 to 72 hours. This would typically be more painful if you've experienced this. Most people would say when you're going down the stairs, and so you are performing an eccentric contraction. And then my next question would be, would this be more sore, painful if you went fast or slow down the stairs? The answer would be generally fast, unless you would think, well, if I go fast, I would have less time going down the stairs, so it would be a shorter duration, but it would be a higher intensity. But generally speaking, if you go fast down the stairs, you're going to be at this top left eccentric. So you're going to notice that if you ever watch someone after leg day or after a day or this, where they generally tend to move a little bit slower during especially the movements when they're first starting out. And then the final question, you would see these questions on exam, but just for fun. You have two fathers and two sons go fishing together in the same boat. They all catch a fish with a total catch for the one day seafood. It's not as possible. Well, so you have a son, then you have a father, then maybe, I got this, you got a grandfather. So you got two sons, and you got two fathers, and so you only got three people. So there you go. That is the quiz, the part 3, the practice quiz. I hope that was helpful, and we'll talk more about this later. Thanks, everyone.